And the fear and uncertainty related to gun violence has an even bigger impact on the mental health of young people. And despite the growing issue, there are a lot of people working to address the problem. And I'm so excited to have this panel of experts with us today to really talk about this issue from all different areas. Would like to take a moment now to introduce them. We have Ashley Carl. She's a licensed professional school counselor and former crisis director at EHS. Thank you, Ashley, for being here. We have Joe Cobb from Roanoke City Council and the Gun Violence Prevention Commission. Thank you, Joe. Stacy Shepard, thanks for being with us from Total Action for Progress in the field of victim services. We are also joined by Dr. Deneen Evans from Mosaic Mental Wellness and Health. Thank you, Dr. Evans, for taking time with us today. Dr. Kate Lebesny from Carilion Clinic Child and Adolescent Psychiatry. And then also Dr. Paula Wolfteich from Carilion Center for Grief and Healing. So thank you all for being here and for helping us to have a better understanding of ways we can make a difference in our community when it comes to violence that we may experience or we may know people who have experienced. Many of you who are joining us now, when you registered, you were asked to submit some questions with your registration. Thank you so much. Some really good questions we have to go over today. This group's going to try to answer all of those questions. We do have only an hour and 15 minutes. So if we don't get to all of them, if you have additional questions at the end of our time together, we'll provide an email address so that you can send your questions there, and then we'll filter them and make sure they get appropriate answers. Just a reminder, today's webinar is being recorded for future use. We hope that we'll be able to reach a lot of people with our message. So let's get started. We're going to dive right into our questions. First, let's talk about how are children talking about national and local gun violence. And Ashley, we'll let you kick it off for us.
So our kids are talking about it, all age groups, and gun violence is a very real and a very rational fear. One of the fundamental basic needs for a healthy child development is having a safe and supportive environment. And right now, during these times, our kids are dealing with issues of gun violence, racial injustice, income inequality, a global pandemic, climate change, and a bunch of adults and leaders on TV aggressively coming at one another and not handling conflict in the best way. So our kids are faced with adult issues every day, and the feeling of safety, while it needs to be a priority, these kids don't feel safe. And whether it's they're at a young age or as teenagers, you see them expressing it on social media a lot more. Sometimes they will joke about it, but their behaviors and their anxieties related to gun violence are drastically increasing. The CDC put out recently that 44% of youths, and I think that that's a low number, but 44% of youths are experiencing feelings of persistent sadness and hopelessness. Suicide rates among adolescents and teenagers are drastically on the rise. And our kids don't know how to handle conflict or handle these emotions. A lot of times they'll communicate their fears, but you'll see them communicating through their behaviors as well, where you can see kids are just a lot more dysregulated. They're seeking adults that are safe a lot more to be able to talk about their anxieties. And more often, we're seeing kids that are thinking through different situations on how they can be safe. For example, where they're seated, we have kids that want to face the door so that they know if someone comes in, how to prepare themselves. And if you look developmentally 10 years ago, those weren't topics being discussed.
And Ashley, let's talk about safety, and we'll take it a step further. And Dr. Wolfteich, I'd like for you to, how do we help children feel less fearful about going to school in the current environment? You heard Ashley talking about some students wanting to sit facing the door so that they could prepare themselves if something were to happen.
Yeah, some great points. And I think it's really important to know your school's safety plan and what they've put in place to ensure safety in the school so you can kind of communicate that to your child. So that could be as simple as, making sure they know about the locked doors, about communication with parents if things happen at school, what the communication plan is, reunification if something happens, where will the parent be? Just kind of what the school is doing for emergency preparedness. But beyond that, I think just making that time and that space to talk to children, to listen to them, to not dismiss their fears, to provide that reassurance and maybe dispel some of the myths that kids have about school violence, that in fact, schools are safe for the most part, and that school shootings are fairly rare or uncommon when it comes to the variety of gun violence that we see. So kind of helping them dispel those myths, listening, and reinforcing that safety plan, developing a safety plan with your child. I think those are really good talking points when it comes to reducing fear.
And talking on the lines of preparation. So, Dr. Evans, help us through this question. How do we prepare for unthinkable acts of violence in our community without creating fear?
Um, Thank you, Karen, and I'm so excited to be part of this panel. Mosaic Mental Wellness and Health was established to specifically focus on mental health issues of minority and ethnic communities in the Roanoke Valley. With that said, most of my conversation points today are going to be made specifically toward African American and Latino communities in the Valley. As we know, this week, we have just experienced our second African American teen, who was killed as a result of gun violence in the Valley. Um, too many, too many of our young people of color in the Valley have been dying as a result of gun violence. It's become normal. We're normalizing it. Um, Even the reactions in the community is not as loud as it was when we first was encountering it. So how do we not make this a normal part of life? How do we make sure our kids aren't going to school and feeling that they're not going to live past 18, so why worry about graduating high school? And that is a very real feeling and thought pattern that our children in our communities have. And that is something that it's a community-based problem. It is no longer just an individual act or by certain schools. It's a community-based issue that we have to get with people in the community to get the answers to it. In addition to me working at Mosaic Mental Wellness and Health, I'm also a faculty member in the School of Social Work. Yes, we can do all the research we want, but if the right researchers aren't getting into the communities and talking to people, going into the jails and talking to the individuals who have committed these acts of violence to find out what the root causes are, we are losing a lot of progress. We're losing it. It's ahead of us. So we have to get community-based. We have to get people who can understand and relate and form trust and bonds in the communities to get out and talk to these individuals who have been shot, as well as the ones who are perpetrating the violence, to find out the answers and solutions.
Thank you, Dr. Evans. And that brings me to our next question. How does chronic trauma impact a child's development? Because it's not just today, it could be weeks, months, years down the road. So, Dr. Lebesny, help us with that one.
It's a big topic, but I will say that we know, of course, that stress impacts the brain and it can change the way that the brain reacts to current stressors and to future stressors. And so, kids who have had a lot of stressful experiences over their life react more and more strongly to the next stressor, and it changes their behavior. We also know when we talk about development that, when something happens and where the child is developmentally changes kind of what the outcome can look like. So when these stressors happen, when kids are very young, we're talking about infants, toddlers, preschoolers, they're still forming a sense of who are the safe people in their life. Who are the people that Ashley was talking to that they can look to for security and safety and consistency? And so it can alter their ability to form those attachments, to form those relationships, and to know what to expect from relationships. The other thing that we sort of talk about is survival behavior. Kids who are under chronic stress learn to do things differently than kids who aren't. They learn to read the emotions around them, to read the behaviors, and to shape their responses in ways that can help them predict what's going to happen next. And as you grow older, and hopefully your situation changes in some way, those behaviors are not always adaptive. They're not always helping you, and they can start to get in the way. So from an emotional regulation, relationships, and even our physiology, chronic stress changes us.
Thank you, Dr. Lebesny. And now, Joe and Stacy, we want to talk a little bit about what our city's doing specifically to make us all as safe as possible. And also, how is the gun violence that we might be experiencing? Is it more prevalent? How's it different from years past? I'm kind of combining two of those questions. So you all take whichever parts and, help us to understand a little more.
Thank you, Karen. We have certainly seen an increase in gun violence over the last few years. It's not unique to Roanoke. We're seeing this regionally, across the state, nationally. Communities around the country are grappling with not only how to be more effective in our responses to persons experiencing gun violence, but in our prevention and intervention efforts. This year alone, since year to date, since January 1st, last year at this time we had 11 homicides in Roanoke. This year we already have 14. Last year we had 37 aggravated assaults. This year we're seeing the same number. The upward trend of those numbers is very concerning to everybody in the community. We conducted a youth and gang violence community assessment last year. And one of the things we heard very clearly from the community, all ages, is people feel less safe than they did 2 years ago. And so part of our work as a gun violence prevention commission with our variety of extraordinary community partners is how to move our community from this rhythm of reaction, where we're always reacting and responding to violence, into a mode of prevention and intervention, and starting that at a much earlier level. In terms of how we're trying to help our community feel safer, we have a very good partnership with Roanoke City Public Schools. We're pleased that they are able to increase the number of mental health workers and counselors on site, that when there are incidents of gun violence, they're bringing in community partners to provide on-site mental health counseling to not only address the trauma that youth and students and families may be experiencing, but how then they can engage those services for the longer term. Stacy and I and the commission have been working with partners like Family Service of Roanoke Valley, Blue Ridge Behavioral Health, to make sure that we're offering trauma basics workshops in the community. Deccan Knight, who is the coordinator of the Trauma Informed Care Network for the Roanoke Valley, is working with us to create a series of interactive workshops for families in locations of our city that have been directly impacted by the higher rates of gun violence. And the reason we're doing that is because many of our families who are experiencing loss, or areas of our city that are experiencing a higher number of incidents of gun violence, these family systems have had generational trauma, sometimes intergenerational trauma, that maybe has been undiagnosed, has not been treated. And so when we have organizations like Mosaic Mental Wellness that acknowledges that reality, then we're better equipped as a community to address that trauma in an intergenerational way. And hopefully by addressing that trauma, we are then putting tools in the hands of families to heal through that and further reduce increased incidents of gun violence in the community.
And Stacy, in your work with victim services, I'm sure that you can add some perspective to that idea of not helping one, but helping the whole, trying to help as many people as possible.
Yes, absolutely. Because we know that trauma begets trauma, right? And so that cycle continues generationally. And some really good things have come out of the work that's being done that, like Joe talked about with the stakeholders and the involvement with many partners that are all coming together for a solution to the problem. But what seems to be missing and what we have identified as our work has progressed through the last, 2 years is we have a great group of partners and stakeholders. But what's missing is this community piece. And we often hear in a lot of our meetings, folks saying, well, why aren't you doing this and why aren't you doing that? But I need to remind everyone there's a capacity issue with the folks that are doing the work that we're doing. And we need the help of the community to do this so that we can break that generational cycle of trauma, and that the parents are involved, the grandparents are involved, the community members are involved, and that everyone is stepping up to help out, that it's not just a nonprofit or it's not just the gun commission, because all of those pieces matter for us to be able to make a difference.
Thank you, Stacy. Let's talk a little bit about resources available to help families deal with loss. Dr. Wolfteich, I'll let you take that one, and then we'll get to you, Dr. Evans, for a similar question.
I love what you said, Stacy, about just sort of that collaborative, interdisciplinary approach, because I think it really does take a village. It's not any one resource or one center that can, provide all of these services. The Center for Grief and Healing is a relatively new organization within Carilion. It's been in development for a while. Historically, we have had support groups for adults who have lost spouses or lost adult children for a variety of reasons. When I began in the program, we've also had, and we still have, the Soul Survivors Group, which is a group specifically for bereaved children and their caregivers. And kids come with a variety of different losses and grief experiences. We are starting actually today a Homicide Survivors Group. It is for adults. And it is based on a program out of the Virginia Victim Assistant Network, where we will actually be looking at and helping individuals process violent death. We recently received a grant to modify that curriculum for suicide survivors. So we're really beginning to change some of the services that we provide and adjust them to the needs of the community, in the sense that we're seeing a lot more violent death, and people are coming to us with violent loss. There's also a wonderful national network, the National Alliance for Grieving Children, which has a variety of resources for parents, for teachers, for adults who take care of children, for professionals in helping talk to children about grief and loss and violence at different age levels. The Dougie Center is another really great resource that really provides a number of tips, especially for parents, to help children heal from loss. But I think it really does take all of us. And I love that Mosaic is here, and Blue Ridge, and Family Services. Many of us are trauma trained. I love that, we have maybe more access to services, especially for minority families who are impacted the most by gun violence. So it isn't just within the walls of Carilion, but there are several folks involved, and that's really good to see.
And this next question's very specific and something that we might not think of. Many of my child's peers. So perhaps your child hasn't lost someone, but they have a friend who's lost a family member due to gun violence. How should I discuss this with them? Dr. Evans, help us with that one.
Sure, thank you. A great question. Gun violence is the leading cause of death for young Black and Hispanic Americans. When Joe mentioned about the statistics in the Valley, I'm quite sure those numbers in terms of people who have died violently by gun violence disproportionately is settled within our inner city areas, within our African American communities. And that's a fact that we have to start really questioning why that is. It takes a culturally responsive approach to addressing a lot of these issues. It takes people trusting individuals who come into the community to try to solve it. Parents are dealing with these emotions also. And a lot of times we're thinking it's just the children, but how are parents responding? How a parent responds is going to have a direct impact on how the children are going to respond to it. And a lot of our parents have dealt, as mentioned here, with this generational trauma for years now, and they haven't received the mental health attention that they need. So starting to get people used to the understanding that they have to address trauma and understand what trauma is. We use that word so loosely a lot of times, but a lot of people don't even understand what that means, especially people when we talk about systemic barriers to care. Systemic barriers that are rooted in income inequalities, that are rooted in racism, that are rooted in systemic discrimination within our healthcare systems, with our education systems. Parents who come from these communities are dealing with a lot. And then when they have to start thinking about trauma, these words that we use, and how to help their children, we have to help the parents so that they can help the children first. It's just like that analogy when you're on the airplane, when the plane is crashing, they tell you put the oxygen mask on yourself first, then your children. As a young parent, that never made sense to me. It now makes sense. We have to be able to help ourselves to breathe before we can help our children to breathe. So I think, again, getting into the communities, working with families, helping them from a culturally responsive way, understand what trauma is, because families of color, especially African American families, have been dealing with trauma for 400 years. So it's normal. It has really become normal to deal with these acts of violence in our communities. So helping parents to start breaking that down and understanding what healthy means so that they can talk to their children in a way that is not re-traumatizing to their children, so that parents can feel safe, so they can help children understand what it means to be safe. They can find pockets of safety in their community and help them to identify who the safe people are, who are the people that they can go to and trust in their community for help.
Thank you, Dr. Evans. Ashley, I see you nodding your head, and I'm sure as a counselor, you interact quite a bit with students who are in a similar place. If there's anything that you'd like to add to Dr. Evans' remarks, feel free.
I think Dr. Evans made an abundance of great points. One thing that I would add to that is I encourage parents to reach out to your schools, to reach out to the school counselors and the school social workers, because kids are talking about these topics. And as a parent myself, we have our emotions with it, and it's very easy to sometimes project what we're feeling onto our kids and make assumptions on their thought processes with it. But as school counselors, we are trained in individual and group therapy and have gone through the clinical rotations as well, and can create different grief and loss groups that is age appropriate. I
Thank
see.
you.
Okay.
Yeah, that's perfect. No, that's great.
Thank you.
And we've talked a little bit about trauma, Dr. Lebesny. So we've discussed that children, students, teens may act differently if they've experienced trauma. perhaps that's something that they would work through or have support to work through. But when should you become concerned about your child's mental health and behavior changes? Even when they say, Mom, I'm fine, or Dad, I'm fine, I don't need any help. Like, when do you know it's time for you to really step in and provide some resources?
Yeah, well, I think this goes back to helping parents and helping communities understand what is kind of typical in a reaction to a traumatic event or an unexpected loss. What are the things that we can expect and support kids through? And then when does it really cross that line? When do we need to be more worried? So, the kind of things that are typical are questions, lots of questions, or needing to just have more closeness, being a little bit clingier, needing to be kind of around the safe people, maybe not wanting to venture out quite as much, having a little bit more difficulty with, rest and sleeping soundly. Those are all things that, would be understandable, and with time and with support and that openness to sort of talk about things, we would expect to get better over time. When we get worried is really when things are starting to impact an ability to do the things that kids should and need to be doing. So when you can't get your kid to school because they're so afraid to go, or they're going to the nurse's office with a physical complaint so frequently because they're so stressed and they need to come home. When they're not sleeping, hardly at all, they think lots of nightmares, things are really fragmented in sleep, that's more concerning. Teenagers are going to be less chatty about their worries. In many cases, they are going to withdraw. It's going to be hard to know, is this just my normal teenager hiding in their bedroom, processing this with their friends? Or is this the beginning of some depression? Is my kid not coping in the way that I, want them to be coping? And so for those age groups, we're looking for, well, are they connected to their peers, or are they in their room and disconnected from their peers? Are they dropping their ability to continue to participate in school or in their activities, losing their interests and their ability to enjoy things? So when we sort of start to see kids just not functioning in the ways that they can, and they're telling us that everything's fine, but we know that they're not holding it together, that's when it's good to start reaching out to these resources. Talk to the school counselor, as Ashley said. Start with your primary care doctor. Let your primary care doctor know that you're worried about some of these symptoms and behaviors so that they can help with assessment and help sort of navigating the resources that are available in the community.
Thank you, Dr. Lebesny. Stacy, I'm going to give you this one. Are there efforts to unite communities and encourage social connections or programs? What should we be doing? And anyone else who wants to weigh in with an answer after Stacy, please feel free.
Yes, I go back to my community supports, right? And to Dr. Evans' point, it takes a village, right? Because it does. There are many opportunities for folks to be involved and help make this a community solution. One example is we have a coordinated community response where when we have an incident of gun violence, we try to coordinate efforts to help the family. That could look like everything from food to coordinate grief supports to clergy to funeral home supports to financial supports, even rehousing and shelter. There's so many things that go into the layers of trauma that a family affects, because we know it's not just one victim that suffers, it's an entire family and generations. And so there's so many ways that other people can help. And so we need people to make those things happen. We need volunteers. We need other organizations. We need people that care and want to make a difference. And aren't sitting back going, what's everybody else doing? Because it does take a village. And those coordinated efforts. And that's just one of many things that are going on. We're reading to school children, the little blue truck. It's just a great opportunity to teach empathy and love and care and respect in our schools. And that's starting at an early age. Well, even something as simple as reading a book to a child, and that one-on-one time, that connection time reading studies have shown can make a big difference. And so those are the things that we're asking people to step up and help.
That's great, Stacy. And a reminder for those of you joining us this afternoon, if you are someone moved to help be a part of this community response and you aren't already, the email address that we share with you at the end, you can feel free to send any messages to that inbox about your desire to become part of this movement. Joe, let's talk a little bit about what kind of training is being made available to schools or even the public now that we're talking about bringing the community in to help with some of the work that's already being done.
Well, it's a great question. The Gun Violence Prevention Commission worked with Family Service of Roanoke Valley to develop a social emotional learning curriculum that is being piloted and utilized by a number of after-school programs throughout the city. And these are programs that work with students who have been at Roanoke City Public Schools and other schools who are accessing this information. It's a way to remind children of how their brains work, how they can better process their feelings, how they can navigate those feelings in a way that doesn't lead to causing harm to themselves or to someone else. And so putting that practice into place has been really important. Just tying into something that Stacy said, one role that the community can play that is absolutely critical is the relational role. We all have relationships, and we all have the ability to communicate with each other and talk through not only the things that are traumatizing to us, but the things that can empower us to be better equipped to respond to conflict when it arises. We've just last week launched a program called First Step, and we're training our first cohort of citizens in the community who want an extensive 20-hour training in conflict resolution. The idea behind this is that as these citizens are trained, they're not only going to be able to utilize this training in their own relationships, but with their families, in their workplace, in their neighborhoods. One of the things we're seeing an increase in is people of all ages, from children and youth to adults, turning to violence to resolve conflict. And we have to reverse that trend. And the best way to reverse that is through these relationships that we have and making sure that those of us who have influence on each other can utilize that influence in a positive way. And I'll share just one more example. We make it a point to engage with youth of all ages, but to hear their voices, to center their experiences and what they're going through, particularly in relationship to violence. And earlier this year, the commission and our youth service providers listened in on a couple of classes, the African American cultural and contemporary issues classes at William Fleming High School, taught by Antonio Stovall, who's also a member of our youth and gang violence prevention team. And one of the things that we heard over and over from these are high school youth, was the increased understanding they have as influencers. So in other words, whatever actions they take, others are watching, and especially younger siblings, young peers. And so what I'm seeing happening in our schools and in our community is youth who not only want to offer peer-to-peer support for their friends to kind of talk them through and away from things that might cause them harm or lead to violence. And we want to be able, and I know the schools are working on this, we want to be able to come alongside them and provide that backup support for them so that they they know what mental health support is available, so that as they're doing this kind of peer-based work, they're helping each other. And I'm seeing a remarkable increase in that regard in our community, and it makes me very happy.
And Dr. Evans, let me let you sort of dovetail off of those remarks from Joe. How does gun violence impact mental health in children and teens? And please share any additional perspective you have on Joe's words.
Sure. Gun violence is a public health crisis. We just went through a public health crisis with COVID, and we attacked it. We put resources in place. This public health crisis, again, is impacting youth of color disproportionately, more than any other community that we see. We have to really examine how our children are being influenced. If you think about some of the programming that's on TV and the amount of time our children are spending watching these programs where there's nothing but gun violence. I mean, I'm amazed at the amount of gun violence on the shows that the kids look at. So this is normal. We're going to replicate this here. What do we need to do on that larger macro level to start making these folk responsible for the content that they're putting out that is targeting these particular communities? Another thing I wanted to add, a large group that we haven't talked at all about, is the role of our teachers in the classrooms. We are still dealing with a large issue, not only in the Roanoke Valley, but nationally, at the number of white teachers that are in schools that are coming from middle-class backgrounds that are going into these schools where they can't even begin to identify. They're good teachers, they're good people. But when you enter into a system that you cannot relate to or understand, a lot of things that they see with these kids, we look at these kids are winding up in out of school detention. They're winding up diagnosed with emotional issues that are coming from trauma, and people don't understand the behaviors that enter into the classroom. So they're not even getting the help because it's such a mismatch between the teachers in the classroom and the students who are coming in. Teachers that don't even understand the community that these kids are coming from and the issues. A lot of times they don't even see the strengths that the kids are bringing in. They're just dealing with these children from a deficit model. So what do we need to do to improve who is in the classroom, who is in the school building with our children? But the mental health issue, we're seeing a significant increase in suicide within African American and Latino community, something that I've never seen. We used to always have a myth that Black people didn't commit suicide. Well, that is no longer true. It is there, I mean, in numbers that we have never seen. And guess what? It is across economic backgrounds. So why is that? Why are we seeing so many kids where in systems and families and communities that we never saw this before, now all of a sudden it's increased regardless of economic background? We have to start paying attention to what is going on in the messaging and the stresses that are in communities with our children. And I go back to, it has to be community-based. We have to go to the people who are being impacted disproportionately and sit with them and get their responses to it. I'm going to forward Joe, and he may already know about it. There are a lot of programs that I ran across that they call them community violence interrupter programs out of some of our larger cities where they've been doing this work for decades. And they have good outcome data on what they're doing and how they're going about, and they are all rooted in the community. They are training people in the community to be like peer mentors. They're going after men in the communities that, guess what, who have had this background. They have been perpetrators of violence themselves. And now they're at a different stage of life where they can address these issues and talk to our young people. And our young people look up to these individuals as role models in these communities. They're not going to look at you and I when we go into these communities that way, but they have to look at people who they can trust, who can talk a language to them that they understand about stress and mental health. And then those of us that are trained to do this work, what is our responsibility for getting people that can relate to these communities and getting them in these roles to do this work as well? So it's a multifaceted approach that we have to take. And Roanoke has been dealing with this for some time. I worked in the schools in the early 90s when they wanted to deny that there was gang violence, and we were trying to tell them there are gangs in Roanoke. They may not look the way you stereotypically look at gangs, but this is happening. So we
Yeah.
have lost easily close to 30 years. We're so far behind where we should have tackled this issue, and now we're at this level. But the mental health needs are profound. I see it in my practice with the children who are coming in, and it looks different across communities. And we have to understand that it's not a cookie cut mode of how this impacts children and how they're responding to it. So there are programs out there, but we have to continue to look at the cultural context in which these children are coming to us and providing culturally responsive practices to helping them.
Thank you, Dr. Evans. Our next question, we'll start with you, Dr. Lebesny, because with your experience in child and adolescent psychiatry, and then I feel like that might serve your expertise best. However, any one of you, I'm sure, would have some opinions on this, and they would be valuable and valid. So feel free to weigh in afterward. So this question is, how can I help my older child be aware of and report any unusual circumstances or social media posts? Unfortunately, with many acts of violence that the news cover and make a big deal about, they go back and say, oh, this person put something on Instagram or this person put something on Facebook. And not to say that every single post that someone puts out there is going to lead to violence, but what is that happy medium for having a child raise a yellow flag, if you will?
Yeah, it's a really terrific question. I think one of the beginning principles is to be aware of what social media your child is using and to have a plan that is as proactive as possible at the point at which you are introducing a phone or fairly independent device to your kid, to have a plan for how you guys are going to communicate and share how that phone is being used. The American Academy of Pediatrics has some tools that are really useful. There's a family media plan, and it looks not just at the things we're used to thinking about, like screen time, but what apps are on there. Parents should have the passwords up to a pretty advanced age, should have the opportunity to take that phone in the evening and look through some of the things that are happening on it, some of the communications and what's being used. That open dialogue creates an opportunity to not just, help protect a kid from engaging in unsafe things online, but to say, hey, I saw that you're exploring this kind of website. Let's talk about some of the things that you're seeing on there. Or then the kid being able to come, okay, somebody posted something that is worrying me a bit. What can I do about that? And to try to talk about those things in the same way that we talk about in-person bullying in schools, right? Like, when do you stand up and say something? When do you get a teacher involved? Sort of thinking and helping kids think about the online space in a very similar way. All over the airport, all over public transportation, we have these signs that say, if you see something, say something, this kind of post 9/11 world that we live in. And I think we have to help kids map some of that onto what's happening in social media, and to know how they can speak up and who are the safe people to bring that to. You know, I will tell kids that I work with, like, I am fine to be the bad guy. If you need to tell me so that I can be the person to report this in a more anonymous way or disconnected way, I'm glad to do that. And I think that's what most of the safe and open adults in the lives of kids are willing to do. I'll be the person who goes to the school. Ashley's going to be the person who will raise it to the principal or to the school board instead of you directly as the kid or the family. These are the things that we can kind of help kids learn how to navigate, really.
Does anyone have to add regarding the power of social media in this area we're discussing today?
I would just say too, I work with a number of teens who've just been socialized to give their phone to their parent, and the parent checks, periodically. And at the end of the day, when they go to bed, everyone leaves their phone out in a common area of the house. So we're not looking at, difficult, violent things before we go to bed. So, and this kind of starts with that relationship that you have with your child and that non-reactive, supportive manner in which you talk very matter-of-factly about these issues. So that a child knows that they can come to you and you're not going to react and not get upset. So it starts early in that relationship with the child. And I agree with Dr. Lebesny, when you first introduce that tablet or that phone, having those guidelines around how you're going to be using it safely.
Ashley, did you want to add something? And you too, Stacy.
Just to piggyback off of that, parenting is not an easy job, and often at the end of the day or when it's time to go to bed, we're exhausted. And I love what Dr. Wiptek said about turning your phone in or having a charging station, because when parents are asleep, when kids wake up in the middle of the night, a lot of times they're going to their phones and can go down the rabbit hole of TikTok or, sorry, the light's in here, or, scrolling or playing Roblox. And then that contributes to the declining in mental health because they're not getting the sleep that they need, or they're trying to connect with individuals that they don't know in person for those relationships and for advice. And so by taking the device and having it in a safe place with the grown-ups, I do think that helps a lot.
And Stacy, you had some.
I do. I just want to add, we know that especially during the developmental stages and I know my healthcare friends here will agree with me, but, we're rewiring the brains. And so that screen time and all of that screen time that's being spent there, and we haven't even talked about video games today. To Dr. Evans' point, when we're looking at TV and what they're seeing and kind of desensitized to the gun violence and the violence that's on television, we haven't even started to talk about video games today and what our kids are doing and playing and how that desensitizes them to the empathy and reality of how precious life is. But we know that screen time and that FaceTime in front of a laptop or a tablet or phone or whatever that looks like is rewiring the brain during these really critical stages. And so as a parent, we have to be mindful of that, because if you don't know that and you don't understand how that's affecting your child's developmental stages, it does factor into whether or not someone is having learned empathy or learned ability to kind of that brain shut down and be able to regulate at night and relax and sleep and regulate and have functions with friends and things like that. So all of those things are things that we have to talk about more, because people don't know, and we have to teach that more.
And while we're talking, oh yes, go ahead, Dr.
I'm sorry, I was just like, can I add something real quick? Another thing, we expect kids in certain communities to take responsibility for things that we in the adult world don't. I don't know how many of you are familiar with the phrase stitches get stitches and end up in ditches. We're asking kids to come to us and tell us about who has guns, who is doing the shooting in the community. Well, as adults, we don't even know how to let people know when the adults around us in the workplace are doing things that are wrong. You look at what has been happening on our federal government level and the corruption that goes on, and we're asking people now, well, if you knew X, Y, and Z was happening at the time, why didn't you tell it at the time? Why did you wait so long? And you hear the responses that the adults are giving about not snitching. But we're expecting these kids to go out here in communities where they have not felt safe. They have not trusted systems in the past. Systems have not done the best with protecting them. And we're expecting them all of a sudden to come and tell us who has the guns, who's doing the shooting, who got shot, and all of this. And it's just very unrealistic, because we haven't even studied long-term what the incentives are for getting people to report. things like this. And we see Chicago is doing some cutting edge work on getting people in the community to feel safe to come forward. But we're putting a lot of pressure on our children in these areas that as adults, we do not do a good job at ourselves.
That's an excellent point, Dr. Evans. It sounds like we all have a lot to learn, figure out, navigate, if you will. We've talked a lot about supporting children. Let's just switch directions a little bit to parents. So this question is, how do I keep myself from feeling angry, anxious, or worried constantly while my child is in school and out of my sight?
Well, can I take this as a parent?
Any one of you, please. This is sort of I
Well,
would love the perspective from each of you.
You know, none of us as parents wants to get a robocall from our schools alerting us to an emergency situation. I have a student at a high school. I have a student at a middle school. In this last week, one of our high schools had 2 bomb threats. And so parents, one day after the other, got calls alerting us to this reality. Now, the thing that impressed me and that I knew was already underway was that the school and the school district were already responding very carefully, very safely, making sure everyone was safe and communicating to parents. So the schools are doing a better job of communicating with parents what the realities are in that environment, which I think, to Dr. Evans' point earlier, that may be comforting to some parents, but it may not be comforting to other parents. But I do think communication, over communicating at times, is more helpful for parents because at least we're receiving information. Then we know what we need to talk with our children about. What did you experience today? What did you feel? Did you have concern about your peers? It can open the door to conversations with our students about their friendships, about people they may be concerned about, things they may be going through, feeling conflicted about. So I do appreciate that extra effort that's taken. And yet I acknowledge that it would be beneficial for us to hear even more directly from parents in parts of our community that are disproportionately affected by gun violence, to hear what would help us feel safer, what would help us feel more comforted when our children are in school, so that we know not only how to support you as teachers, administrators, school counselors, but what we need to do on our end at home.
Anyone else would like to weigh in on that? How do I keep myself from feeling angry, anxious, or worried constantly while my child is in school and out of my sight? Maybe some of you as parents have some words of wisdom to offer, things that maybe help you or have helped you.
I have a daughter in college, and an alert went out the other day about some heavy police presence in her community, and she's a graduate student. I was relieved because she was home, but we have a language to sit and talk about that. And I love what Joe said. Not everybody, I mean, having the language and the ability to process this information is, believe me, it's a very middle class way of doing it. And when you have people that don't have the language to put with their feelings, of course, it's going to come across in anger, in fear. So being able to teach people how to express themselves, having them really look at the reality. And in some communities, guess what? This violence is real. Some communities it's not. So we could talk about that from that perspective around statistics. Okay, statistically, how safe do you really feel? Do you think this is really going to happen? But in some communities, the reality is, yes, there's a high percentage that this may happen. So being able to give people language to deal with their feelings from their way of understanding it, not always from our lenses, those of us who come from middle class backgrounds with, you know, a plethora of vocabulary to use to describe this, and helping people be able to put vocabulary with feelings. it's so important, and that's important as a parent across the developmental cycle with our children.
And to add off of what you're saying, Dr. Evans, and that you brought up earlier, Stacy, is reading books. And the library has many amazing books as well. There's a lot online that you can get and see, or go to YouTube where they read it. But here is an example of like what we are trying to do in the schools is really teach at an early age, identifying those basic emotions. It's a little spot of feelings.
Oh, nice.
Yeah, but and these books were designed for kindergarten, first, second, third grade. I have fifth graders that enjoy them, but it really breaks down on how to identify basic emotions and ways that you can cope with that. And so if parents are able to read that book, read those stories with their kids, or even put the phone down, put everything away for 5 minutes, 10 minutes, 30 minutes, and give your child uninterrupted time where you're communicating. Ask about 2 or 3 positives of the day to get them sharing. That's going to help increase dialogue so that when the scarier times do happen, or when your child is escalated, they'll be comfortable coming and talking to you.
It sounds to me, if I had to give the foundation of your work, if I had to describe it with one word, it would be trust. That each and every one of you is working to build trust with all people within the community. And that trust is through resources, through knowledge, through support. We are at a little less than 20 minutes. So we have one important question I want everyone to have an opportunity to answer. We've gotten to just about all of them. We have a couple out there, but we're going to start with you, Paula, and then I'll call on everyone so it doesn't become confusing. Talk about any frequent safety concerns in our community that people talk to you about.
Yeah, so I think, the media is full of stories about school shootings, but the children and teens and adults that I see are bringing stories of gun violence in their own neighborhood, outside their window at night, hearing shooting. Suicides are on the increase, and with increased access to guns, we see more violent suicides with gunshot. Bringing stories of just being afraid in stores and people coming in violently. And so it's not just school shootings. They're actually relatively uncommon, but there's other forms of violence that kids are experiencing. And even in schools, they're experiencing other forms, bullying, watching fights, a lot of kids exposed to domestic violence, kids that have lost a parent due to domestic violence. So I think it's important to kind of go beyond what we see in the media and really know that these things are happening. They're disproportionately impacting families of color. And I think that, to go back to what Dr. Evans is saying, we need to maybe get at the root cause of that and really look at that, and not get as caught up in the school shootings, because there's so much more going on that's impacting mental health. And I also just wanted to add, when we were talking about parents, just doing your own check-in, and making sure that, often parents that are anxious have children that are anxious. Parents that have had prior trauma tend to react to trauma that's occurring maybe at a higher level. So making sure that you're getting the resources and the support that you need to kind of put that oxygen mask on and take care of yourself, so that you're not projecting that anxiety onto your child. Just wanted to add that.
Thank you. And Stacy, I'll repeat the question. Talk about any frequent safety concerns in our community that people talk to you about.
We hear almost daily about safe housing, and housing just in general here is, that's just a whole nother conversation, but especially safe housing. Because of, what Dr. Evans is talking about with underserved and many socioeconomic problems that our youth are facing, the housing that they are in is not safe. And that looks like everything from the neighborhood to the lighting to even the domestic abuse within the home. And so we hear that over and over again, which is extremely concerning, but especially more so in the past year and a half with COVID. I joke it's not a joke, but I'll say, if anything good came out of COVID, it's the fact that many people no longer want to be quarantined with their abusers. They don't want to work from home with their abusers. And so we have seen a large increase in folks escaping domestic violence. And that's great if you're an adult and you have the means and the ways and the resources and the ability to do that. But as a child, if we think about their access and the ability to do that, the folks that they're going to turn to are typically in the schools. It could even be a clergy member or someone from the faith community, but it's going to be someone that they trust. So housing for us has been the largest thing that we've heard about.
Ashley?
I'm going to say loneliness because I've seen a drastic increase, and that being the primary or the first feeling that is reported, as well as different studies that have come down. It's showing nationally as well, where Go ahead.
Ashley, would isolation also be in with that same bucket? So loneliness and isolation?
I think so. I mean, somewhat for some situations, but I think that our kids are feeling a lot more of that loneliness, even when they're surrounded with peers.
Okay.
Because they're questioning maybe their curiosity. They're seeing differences. Differences are being pointed out a whole lot more in the media. Adults are arguing a lot more in the media about what kids should and shouldn't do, or should question and shouldn't question. And you're seeing kids that are just second guessing themselves a lot more and feeling isolated, among a room of people.
Wow, and when you identify that in a student or someone comes to you, in just a few words, what are your first steps to try to have them understand they're not alone?
My first steps would be to understand each situation is different, obviously, but to find common themes amongst peers and to do group therapy, which has been helpful for a lot of the kids, so that they know that they're not the only ones struggling with that specific topic.
Excellent. Thank you. Dr. Lebesny, our question was, talk about any frequent safety concerns in our community that people are talking to you about.
So I happen to kind of have a fairly high proportion of kids identifying on the LGBTQ plus spectrum in my practice. Interestingly, maybe disproportionate to Dr. Evans. That's sort of the minority population that has made its way to my clinic office the most. And I'm hearing a lot from this group, fears about their physical safety at school and in the community, and their fears about national conversations about whether their identity or their developing identity is going to be rejected, denied, or attempts to basically eliminate their existence. And they're very worried about what could be coming their way. And I can tell you, because of some things that made the news over the weekend, that I had 3 of these conversations yesterday about what will my school experience be like if things in a legislative way sort of move in a certain direction. So those are some of the most frequent conversations happening in my office.
Joe, same question. What are people talking to you about?
How much time do I have?
Well, we want to make sure that Dr. Evans has enough time. And then I would like, so when we get to our, let's give a couple of minutes for you, Joe, a couple of minutes for you, Dr. Evans. And then I'd like to have each one of you just sort of do a roundabout, if you have just a few words of encouragement and support that you think that could be helpful in this conversation. So Joe, I'll let you get started on what are the things that people are talking to you about as far as their safety?
What I'm hearing a lot about is just the intersection of a lot of these vulnerabilities we've been talking about, and an increase in high-risk behaviors. So gun violence, opioid use, overdoses, chronic severe mental illness. These are showing up in the forms of, people causing difficulties at local stores or in neighborhoods. We're seeing increased activity of people just randomly walking through people's yards or taking things off their front porches or laying down. We're still struggling to address encampments throughout the city that are popping up in different places for a variety of reasons. And it's concerning. Businesses are coming to me saying, people are cutting our fences. We put up all these security measures and we're still having issues. And so I think we're seeing this congruence of a lot of these challenges that everyone's trying to grapple with and face. And some of this was kind of exposed by COVID, I do believe. But some of this is, I think our community's coming face to face with how our communication and relationships have changed markedly since these phones and social media. How we don't fully understand the repercussions of untreated and unattended mental health crisis that's continuing to reveal itself. And to Dr. Lebesny's point, just at a very core level, forgetting what it means to honor and value each other as human beings. Acknowledging that we're all going through extraordinary circumstances. This sense that we're just can easily dismiss each other or cancel each other out, or just by the flick of a pen say, well, you can no longer use the bathroom in your school that aligns with your gender identity. I mean, those sorts of actions just diminish, demean, and discount the journey that someone is on. And so I think we need a restoration of kind of that intrinsic value and core value of love that we each have the capacity for, but need to find a way to restore that, starting with our own relationships and with ourselves.
Thank you, Joe. Dr. Evans, talk about frequent safety concerns that you're having conversations with the folks about.
Sure. What I'm hearing from families and children, teens, and African-American community are access to guns, how easily. I've talked to families where their children have been compromised. They don't have a clue where their children purchase these guns or where they're getting these guns from. It's not like they had guns in their home. Retaliation. What happens in communities when someone is shot, and the retaliation that goes forward after that is a major issue and a concern. Poverty seems to be a root of a lot of this, and we spoke about a lot of the issues around poverty. Fatalism, that fatalistic idea in the Black community, like I said, I'm not going to live anyway, so what do I have to lose? A lot of these things that in speaking to people, and when we look back at the history of what African-American communities have had to endure with trauma, from slavery moving forward to the civil rights movement even forward now to the Trump era and issues that have come out of that. What we're seeing is that there's a diminished role with spirituality and religion across the board in America. But spirituality and religion is what held Black community together, what prevented suicide, what prevented a lot of the violence. And that has just really decreased within our communities. And we're seeing it. We're seeing it nationally all over within all groups, but specifically that was the one strength that Black community had. And when we look at the role of church attendance, it has decreased. The role of churches being active members in the community, it has decreased. But I'm glad to see that there are some younger ministers coming into the area, specifically within the Black churches, that are very much involved with getting out in the community, making decisions, bringing resources, and trying to bring our children and our youth back. We are losing our children across the board. They may be dying from opioid use in Southwest County, in those schools out there, but they're dying from gun violence in our inner city areas. But when we lose children at ages like this, it is a community public health issue that needs to be addressed. All of these people need to be in the room, parents, talking about how do we prevent losing another child, whether it's gun violence or drug overdose.
And we thank each and every one of you for being with us today. We're at our 4-minute mark. Dr. Wolfteich, if there's one thing you want people who see our conversation, if there's one thing you want them to take away from our time together, what would it be?
That's one thing, huh? I think, gosh, well, we talked about, talk to your children and be knowledgeable and know your safety plans, but I think there's hope. Anytime I do talk like this, and it kind of normalizes discussions about grief and loss and violence to where maybe what this will bring to the community is that it'll open up a dialogue and we'll come to the table and establish those connections. But I think this is a great first step, and that there is hope that things will get better. There's a multidisciplinary approach going on in the Roanoke community to address this issue. And that's kind of what I learned today and what I'd like to take away from it.
Stacy, same question. One thing.
I agree. There's hope. For the first time in a long time, we have a lot of stakeholders that are really, truly invested in wanting to make this change, and the community's paying attention, and we just need more people to do that, to make that work.
Ashley, are you echoing Stacy's message?
I am. I was going to say, yeah, you have a lot of different professionals that are invested in this, and these are topics that, we all are working to find solutions on. And for parents, I would encourage you, be a part of the solution, reach out and see how you can assist.
Dr. Evans, what's the one thing you would want our viewers to take away from our time together?
I want our professional community to engage in culturally responsive practices. And I think once we start understanding what that means, I think we're going to be able to resolve a lot of the challenges that these communities are facing.
Joe, same question.
Just a quick story of hope. Our youth and gang violence prevention team works with a number of youth who are seeking to emerge from gang life and culture. And they've been working with one young man who actually was injured this last year in an incident. He is recovering. He's on a path to healing. He's graduated from high school, and with their help, he's enrolled in college. So I think these stories of connection and relationship are what will make the difference.
Thanks for sharing that, Joe. And Dr. Lebesny, what's the one thing you would want folks to take away?
Oh, it's hard to be at the end. I think that what I'd like people to take away is that we have a lot of work to do. But I think, as Dr. Evans has made so clear, in addition to many different types of professionals working together, we need to find ways to make sure that we are engaging and including people of different backgrounds and different experiences in this work and in this process of change. And so if that mobilizes people who are parents into contributing their knowledge and insights, if it mobilizes people who aren't sure where they want their career to go, but know that their life experience would bring value and fill a need that we don't have in the professional community that we have available to us, that's what we need. And it's been a long road to be here, and it is not going to be a short road to restoring some things that we need to make kids and families feel safer in their communities and work more effectively together.
Well, I think we took a large step in the right direction today with this conversation. Thank you, everyone, our panelists, and to all of you who took time out of your day to join us. We got to most of the questions, but if we didn't get to your question and you have additional ones, or perhaps you're someone who's listening in and you want to be a part of this great network that has developed and continues to develop, you can email the email address you see on your screen. That's cgh_info@carillionclinic.org. Find additional resources at carillionclinic.org/grief. In the meantime, thank you all so much for joining us. It was great to meet you all, and I hope that we get to talk again sometime soon.
Thank you.
Thank you.
Thank you. Take care, everyone.